Assalamu alaikum. My name is Dr. Imran and I am with Dr. Arslan and Dr. Tahir. We are here for the physical examination of skin, hair and nail. Our topic is integumentary system. What is integumentary system? Integumentary system is an organ system consisting of skin, hairs, nail and exocrine gland. Its function to waterproof, cushion and protect the deeper tissue, excrete the waste and regulate the temperature, and it's interspersed with sensory receptor to detect the pain, sensation, pressure and temperature. What makes up the integumentary system? Your integumentary system is an is an organ that consists of few main structures: skin, nails, hairs, and glands. Skin also include epidermis, dermis, subcutaneous tissue, and glands of skin, along with the nerves and blood vessels that support them. What are the major functions of the integumentary system? Prevent, prevent penetration barrier, protect the physical, chemical, and thermal stimuli, regulation of temperature, perception of sensory organ and stimulus, pain, touch, pressure, and temperature, identification of any object, communication, wound repair, and absorption and excretion, and production of the vitamin D. Physical examination of skin, hairs, and nail. A careful systemic examination of the skin, hairs, and nail is an essential and cost-effective method for the evaluation of diagnosis of the skin disorder. It is important to examine the skin for the lesion that is directly related to the chief complaint and for the identical finding, especially for the lesion that may be the skin cancer. A study done in the dermatology clinic in Florida found that 56.3% of the melanomas that were found during a full body examination were not mentioned in the patient presenting complaints. A full body skin examination can easily be incorporated into the routine examination of the other area of the body. A problem-focused history is sufficient for the most common skin disorder. If the patient has a systemic complaint or if the disease such as lupus erythematosus or vasculitis are suspected, a detailed or comprehensive history may be needed. During the examination with the patient seated and facing you, scan the skin for the variation in the skin tone, looking for the features such as pigment variation, erythema, flushing, jaundice, pallor, or cyanosis. Touch the skin lightly to check the abnormality, variation in the skin temperature, and for the increased sweating. Check the turgor and elasticity of the skin by pinching the skin over the dorsal hand and forearm and quickly releasing it. The skin should quickly return to its normal position. A limited problem-focused exam may be all that is needed for some chief complaints such as warts or acne in the child or young adult. However, there are several indications for the total body skin examination. These include the personal history or the family history of the skin cancer and presence of the risk factor for the skin cancer, like history of the severe sunburn and immunocompromised status. Presence of a generalized skin rash such as atopic dermatitis and psoriasis, and ill patient diagnosis of the unknown and in doubt. Now I will ask Dr. Arslan, then he start examination.
Assalamu alaikum. My name is Dr. Arslan. I am here to be your doctor today. Can you please tell me your good name?
Tahir,
Your age?
23,
Your occupation?
student.
Tahir, I am here to assessment on your skin, your nails, and your hair. Why we need to do this? We do this to ensure that everything in your body will be going to normal, and if we find any discomfort or any abnormality, then we are going to prevent from you from further complications. And I assure you that every information I gather will be kept private and confidential. Do you have any question for me before we begin?
No.
Okay, Tahir, now I will ask you some question about your past history. Can you please cooperate with me?
Yes, sure.
Do you experience pain or itchiness?
No.
Do you have any skin problem like rashes, lesion, dryness, oiliness, or bruises in your skin?
No.
Do you observe any changes in your nails?
No.
Do you have any allergic reactions on food or medicines?
No.
Does any of your family member have a skin problem or skin cancer?
No.
Okay.
Now we will examine the integumentary system from head to toe. First of all, we examine the scalp and the hair. Evaluate the hair for any abnormal changes in texture, the presence of fractured hair fibers and pattern loss. Palpate the scalp for tumor, cyst, papule, and plaques. Visually inspect the scalp by parting the hair at regularly spaced interval. C1. Acne keratosis on the scalp. A skin graft from the removal of the previous squamous cell carcinoma is evident. Now, head, face, and neck. The face is the most common area for the basal and squamous cell carcinoma, so careful inspection is important. Lightly palpate the face for the presence of the gritty, rough keratotic area that could indicate the presence of the actinic keratosis. Carefully examine all the area of the face, especially the central portion for the evidence of the skin cancer. Inspect the neck for the evidence of the sun damage and tumor. Palpate the lymph node. Metastatic head and neck carcinoma may involve the anterior and posterior cervical lymph nodes. In seborrheic dermatitis and basal cell carcinoma showing the peripapule and telangiectasia. Now, eyes, nose, throat, and ear. First of all, eyes. Check the sclera for the evidence of the conjunctival injection or jaundice. Avoid eyelids to examine the palpebral conjunctiva. Nose. Examine the nostril for the tumor or erosion. Oral cavity. Using a tongue blade and a light source, examine all the surface of the mucosa, looking all the erosions and vesicle white and red, brown macule or plaques. Gently grasp the tongue with the gauze pad so that all the surface can be examined. Examine the teeth and gums for the abnormal dentation, cavities, abscess, and periodontal disease. Ears. Lightly palpate the ear for the presence of the rough, gritty, keratotic area. Examine all the aspects of the ear for the tumor with special attention to the post-auricular area where the tumor may go undetected. Dr. Arslan, continue.
So Tahir, for this examination, I need to touch the certain parts of your body. Can you allow me to do this?
Yes, sure.
Okay. Now first of all, we will check your hair and the scalp area. Then I will observe your face, and then I will touch and palpate your lymph node. Can you allow me to do this?
Yes.
Thank you. Here I just want to see any scalp lesions or any tumors or any pattern loss of hair. So I observe that my patient have a normal hair pattern, and I don't see any scalp lesion or tumor on the scalp of my patient. Next, I will want to see the face and the skin. Here I want to see any deformity or any in eyes. I want to see the conjunctiva. So here I observed that my patient hair is smooth and thin. He has clean and dry skull. I don't see any tumor, cyst, and lesion on the scalp. The hair pattern is the pattern of hair loss is no pattern of hair loss. And now I want to palpate your face to observe the temperature. Can you allow me? For temperature, I want to use the back surface of my hand because it's more sensitive to temperature. So I don't see any temperature or any feeling of temperature. Now in the neck region, I want to palpate for the lymph nodes. From here, I want to first palpate the preauricular lymph node. Like at this area, I will palpate with three middle fingers here for preauricular lymph node. For here posterior auricular lymph node, and for here mental lymph nodes, submandibular and submaxillary lymph nodes, and on here we have a scapula bone. We will observe here the superclavicular lymph node.
Arms. Examine all the surface with close attention to the elbow and antecubital fossa, as these are the common site for the psoriasis and the atopic dermatitis respectively. A flexor wrist are the common site for the dermatitis scabies and lichen planus. A discrete flat topped papule on the wrist. Hands. Examine all the surface of the hands, include the web spaces. The hands are the sites of the involvement of the many common skin disorders such as irritant and allergic contact dermatitis and less common disorders such as connective tissue disease. Dorsal hands are the sites for sunlight related disorders such as actinic keratosis and the photodermatosis. Continue, Dr. Arslan.
Now I want to examine your arms. Can you please put your arms in front of me? Okay. Here for elbow, I want to see the cirrhosis and an anterior cubital fossa. An anterior cubital fossa, I want to see any for dermatitis, and at the wrist position, I want to see the dermatitis and scabies. On a hand, I want to see allergic dermatitis, sunlight related disorder, and photodermatitis or actinic keratitis.
Now, fingernails. Examine the nail plate for any abnormalities such as thickening and ankylosis, distal nail plate detached from the nail bed, horizontal or vertical defect, and evidence of the clubbing. Examine the nail bed for the pigment or color changes or splinter hemorrhage. Use a dermatoscope or ophthalmoscope at +12 to +20 to examine the nail bed capillaries, which should look like a picket fence. Look for the evidence of the dilation of any irregularities, as these findings may indicate the presence of the connective tissue disorders. Leukonexia and the Bio's lines. Continue, Dr. Arslan.
Can I touch your nails to inspect it?
Yes.
I observed that the nails are clean and groomed and normal, and no pigment or color changes or splinter hemorrhages I have seen.
Now, trunk. Trunk examination in the male can be done with the patient remaining in the seated position. Many clinicians perform the trunk examination in the female with the patient lying down to allow for the appropriate draping. Begin with the examination of the chest, paying special attention to the central part of the chest, which is an area of the frequent sun exposure and sunburn. In female, lift the breast if needed. Examine the inflammatory area to check for the candida infection or enterigo. Examine the axilla for the presence or absence of the hair and any skin lesion. Check for the lymphadenopathy if indicated. Careful examination of the back. 40% of the melanomas in the men are located on the back, especially on the upper central back. Acne vulgaris and triasis rosea. Abdomen. The patient should be asked to lie down for the rest of the examination if he or she has been in the seated position. Lift and separate the skin as needed to examine the body fold area in the obese patient to check for any evidence of the candida infection or enterigo. Check the inguinal area for lymphadenopathy and sign of the fungal infection. Dr. Arslan, continue.
Tahir, now I want to examine your trunk area, and can you allow me to do this?
Yes, sir.
Here I want to see the upper central chest area, because this is the common site for sun exposure and sunburn. Secondly, I want to see the back, because it observes the site of melanomas. And now, Dr. Tahir, I want to observe your abdomen. Can you please lay down on the couch? Thank you. Here I just want to split and spread the skin. I observe the candida infection or integro. Now I want to observe the inguinal area for, because it's a common site for lymphadenopathy and fungal infections. So I observe that here I don't see any abnormality.
genitals. In male, the surface of surface of the scrotum and the penis should be carefully examined for the skin lesions. If the patient is uncircumcised, the foreskin should be very retracted. In female, the entire vulva should be examined. The vagina should be examined if there are any sign of what or malignancy of the vulva. Legs. Examine the anterior and medial surface of the legs. Over 40% of the melanomas in the women are on the legs. So it is important to note the pigmented or the other suspicious lesions are noted. The knees and the popliteal surface are common area for the involvement of psoriasis and the atopic dermatitis respectively. The lower legs should be evaluated for the sign of the edema, stasis dermatitis and ulcers. Distribution in picture 1, distribution like flexure atopic eczema in the popliteal fossa and the ankle and the extensor surface psoriasis on the skin. Feet. Check the feet for the pallor and decrease the temperature as this may indicate the vascular disease. Check the dorsalis pedis and posterior tibial pulses if indicated. Carefully examine the feet, especially the plantar surface in the diabetic patient for the evidence of the neuropathic diabetic ulcer. Check all the toes webs for the presence of the scales or the fissures that could indicate a fungal infection. Toenails. As with the fingernail, examine the nail plate for any abnormalities such as thickening, ankylosis, horizontal or vertical defects, and ingrowing of the nail plate into the cuticle fold. Dr. Arslan, continue.
Dr. Tahir, please lay down on the couch. I want to inspect your legs. To examine the legs, first of all, we will examine the interior and medial side of the legs. Then we will come into the popliteal surfaces, and in the end, I will observe the feet. In the interior and medial surfaces of the legs, I want, because these are the most common sites for melanoma and pigmented lesions, and the knee and the popliteal surfaces, I want to see the cirrhosis and atopic dermatitis. And on the legs here, I want to check the edema, because I will palpate and press here to check for edema. My patient's skin quickly returns to normal, so no sign for edema. On feet, I want to observe for scales, fissure, fungal infections. I don't observe any infection or any tumors on the feet. And toenails, I just want to see the thickening, oncolysis, horizontal or vertical defects. Here I can't see, observe, or can't see any abnormality.
You talk. As the point in the examination, the patient should be asked to turn lying face down on the examination table so that the buttock area and the posterior surface of the legs can be examined. If this is difficult or uncomfortable for the patient to do, complete the examination with the patient lying on his other side. Examine the gluteal cleft and the perianal area. These sites are often affected in the inflammatory disease such as psoriasis, lichen sclerosis, respectively. The perianal area is also the potential site for the warts. Lastly, they help the patient to step off the examination table if needed.
Tahir, now I want to observe your back and the buttock area. Can you please lay down? So I want to examine you. Lay down. Posterior.
Yeah.
Ulta. Here I want to examine the gluteal cleft and the perianal area, because these are the common sites for inflammatory diseases such as cirrhosis and lichen sclerosis. From back, I want to see the melanoma. I want to see there's no melanoma or any perianal diseases. Okay,
Dr.
Tahir, you can.
Thank you.
Thank you.
Now I am here to summarize. Yes. Now I am here to summarize my exam. Please, Tahir, correct me if I made any mistake. You don't have any skin lesion. Your skin is smooth and thin. You have a normal temperature and moisture. You don't have any signs of edema. For your scalp and hair, your hair is good condition and color is black. No pattern of hair loss. On your eyes, I did not find any signs of conjunctiva. I don't see any erosion, vesicles, white, red, and plaque on in the oral cavity. Teeth and gums are normal, having no abnormality. I don't see any abnormality or tumors in your arms, hand, and wrist. I don't observe any infection on abdomen. Did I miss anything? Is there any specific concern that you want to me to give attention? Okay, okay. If none, thank you very much for your cooperation.